How much sodium should we be eating every day? The World Health Organization says that we should be eating at most 2 grams of sodium per day. Other influential organizations say about the same amount. There is much evidence to suggest, however, that we should be eating much more than that. Like any nutrient in the body, eating too much or too little will cause us health problems. I was inspired to look into this topic after reading Dr. James DiNicolantonio's book, The Salt Fix. I went through all of the studies myself that he mentions in that book to verify his claims, and I've found a number of studies on my own to make sure I was getting an unbiased look at the research. What I've found will surprise you. As I talked about in my last video on salt and blood pressure, there was a meta-analysis done in 2021 that looked at the relationship between sodium intake, life expectancy, and all-cause mortality, taking data from 181 different countries. The authors found that there was a positive correlation between sodium intake and life expectancy, and a negative correlation between sodium intake and all-cause mortality. These relationships no longer held up after about 4 to 5 grams of sodium per day. In other words, according to this study, increasing your sodium up to about 5 grams a day will maximize your life expectancy and minimize your risk of dying from any cause. Going above 5 grams results in a slight decrease in life expectancy and slight increase in risk of dying. The study noted that the low sodium guidelines of the American Heart Association, the World Health Organization, and the European Society of Cardiology are all associated with rather low life expectancy and high mortality. No surprise there. A meta-analysis from 2014 by Graudal and colleagues found that if you consumed less than 2.7 grams of sodium per day, or more than 5 grams, you were at increased risk of dying from any cause and developing cardiovascular disease. The interesting thing about this study is that they looked at those at the bottom of the 2.7 to 5 gram range and those at the top, and found that people who eat only 2.7 to 3.8 grams of sodium per day were no more likely than those who ate only 3.8 to 5 grams per day of sodium to die of any cause or contract cardiovascular disease. That is, if you eat anything between 2.7 to 5 grams a day, you're fine. But again, with this study, we see that eating more sodium than the recommended 2 grams will make us healthier as long as we don't go over 5 grams per day. A meta-analysis from Menti and colleagues from 2014 looked at over 130,000 individuals from 4 studies that analyzed sodium intake, hypertension, cardiovascular events, and all-cause mortality. They found that, compared to 4 to 5 grams of sodium per day, consuming more than 7 grams of sodium per day is associated with an increased risk of cardiovascular events, things like heart attacks, and death in people with hypertension, but not with people without hypertension. People who consumed less than 3 grams of sodium per day had increased risk of cardiovascular events and death, regardless of whether they had hypertension or not. A little nuance from this meta-analysis is that it's okay to eat more than 7 grams of sodium per day as long as you don't have hypertension. If you have hypertension, however, eating more than 7 grams per day will put you at increased risk of heart problems and dying from any cause. Here's one more meta-analysis for you. This one was done in 2019, published by O'Donnell and colleagues, and shows the same thing as the previous studies. That is, around the 3 to 5 grams of sodium per day range minimizes death and cardiovascular problems. However, this meta-analysis also looked at potassium intake. It found that 3 to 5 grams of sodium per day with more than 2.1 grams of potassium per day had the lowest risk of mortality and cardiovascular events. Whether you consumed a low sodium diet, moderate sodium, or high sodium, if you consumed more than 2.1 grams of potassium a day, you experienced less mortality and heart problems than those who consumed less than 2.1 grams of potassium a day. So make sure you're getting enough potassium to balance with your sodium. Now, why is low sodium associated with health problems? It's because low sodium intake increases renin, aldosterone, noradrenaline, angiotensin, cholesterol, triglycerides, and resting heart rate. Although necessary to keep the body in homeostasis, all this takes a toll on the body over time, increasing the risk of heart attack and cardiac death. If we keep our sodium consumption above 3 grams per day, however, these emergency measures that our body uses to maintain a proper blood volume would not be used too much. The average sodium intake for the whole world is about 4 grams per day. Between 1990 and 2010, this did not change. Despite calls to decrease sodium intake for decades, the average sodium intake of 3.5 grams a day in America has not changed between 1957 and 2003, according to a study by Bernstein and colleagues. A study by McCarran and colleagues examined sodium intake in the United Kingdom. Like the previous study, they found that despite calls to lower, the average sodium intake of 3.5 grams did not change between 1984 and 2008. The study went on to combine UK data with the Intersalt study data, which looked at 52 populations from across 32 countries, and found that almost all of these places had an average sodium intake between 2.7 grams of sodium per day and 4.9. All these data suggest that man's salt intake is set within a physiologic range, and so people will naturally tend to remain within this range instead of heeding the call to lower their sodium intake to what I would call dangerously low levels. But what happens when we try to go below this physiologic range? We may not tend to do so naturally, but can we do it? Can we abide by the World Health Organization's guidelines on sodium intake? The answer is no. In the trials of hypertension prevention phase 2, the low sodium group was supposed to consume 1.8 grams of sodium per day max. They were given intensive dietary counseling to achieve this goal. Nevertheless, their average sodium intake after 36 months was 3.2 grams. This is much more than the desired 1.8 grams per day, but closer to the control group who were eating 4 grams per day after 36 months. There was a study done by McCarran and colleagues testing the effects of sodium restriction in hypertensive patients on an antihypertensive drug. The patients had an average sodium intake of about 3.2 grams per day going into the study. They were given an extensive manual and weekly dietetic counseling to achieve an intake between 1.4 and 1.8 grams of sodium per day. Of the ones that achieved this range, not all of them did, their average intake was just under 1.8 grams. During the 4 weeks of the placebo treatment, however, they naturally increased their sodium intake to 2.8 grams, way above what they were counseled to have. A different group was given a 2.3 gram tablet of sodium each day, and they naturally gravitated to an average intake of sodium of 4 grams a day. We might have expected them to consume 5.5 grams per day, given the fact that their initial baseline was 3.2 grams per day, but clearly their bodies knew that they didn't need as much sodium if they were given a sodium tablet every day. In a trial known as the Trial of Hypertensive Interventions in Management, a group was counseled to reduce their sodium consumption to below 1.6 grams per day. It should be no surprise that only 25% of patients were successful in achieving the low sodium diet. Finally, in the trial of non-pharmacological interventions in the elderly, a group of the participants aged 60 to 80 were given extensive counseling to achieve a sodium intake of less than 1.8 grams a day. At the 9-month follow-up, only 36% were able to reach this low sodium goal, and after 30 months, 40% of them were only following it. In sum, the majority of people, even with lots of medical support, simply cannot stick to a low-salt diet. I'll now go over evidence that man's taste preference for salt is determined by biological need, not conditioning or hedonistic desire for pleasure. According to a review I found of a book called The Hunger for Salt by Derek Denton, a sheep that is depleted of 11.5 to 16.1 grams of sodium, when presented with a high sodium drink, will rapidly drink enough of it in 2 to 5 minutes to replace around the same amount of sodium that was depleted. This shows that animals have an instinctive sense of how much salt their body needs, and if they have this instinct, then we probably do as well. The natural daily salt intake of sheep and rats have been recorded, and if you adjust this amount in proportion to their body weight to the average weight of a man of about 150 pounds, we see that the intake of sheep corresponds to about 8 to 9 grams a day, or for rats it is about 15 grams a day. It seems then that the average intake of about 10 grams of salt per day for man is well in line with what an animal would naturally consume out in the wild. This suggests that the 10 grams which man consumes on average per day are consumed out of biological necessity, not out of pleasure. A paper by Clark and Bernstein reviewed evidence that showed that 1. Rats depleted of sodium will seek out, work for, and consume concentrated salt solutions they would otherwise avoid. 2. Dopamine is released when a sodium-depleted rat consumes salt. 3. Sodium depletions in a rat sensitize a rat to increase his salt intake. And 4. This sensitization is associated with changes in the brain. Indeed, a study by Sakai and colleagues noted that salt depletion in rats can cause lifelong increased salt intakes. It seems that the hormones angiotensin and aldosterone are not only secreted to retain sodium and increase a preference for it, but also to rewire our neurology to increase our desire for sodium. This leads one to the paradoxical conclusion that lowering our salt intake in the short term may actually increase it over the long term. A study conducted by Wald and colleagues analyzed how much athletes would prefer a salted drink based on how much they sweated. If you did not know, we lose sodium in our sweat. You can check out my video on salt and exercise for more on that. Anyway, in a study, they found that more someone sweated, the greater the flavor a salted drink had for them. By contrast, if they were given a 14-gram salt capsule beforehand, they experienced an aversion to drinking a salty drink relative to an unsalted one. This goes to show that the more a body is deficient in salt, the greater it tastes, which encourages us to seek it out. When we have had our fill, the taste of salt becomes bitter, and we avoid it. Another study was conducted by Lesham and colleagues on sweat and salt preference, this time with soup. They found that after exercise, participants increased the amount of salt in their tomato soup by about 50% compared to how much they had in before they exercised. This is more evidence this time in food that when we crave salt, it's when our body needs it. Another study by Lesham found that participants who had their sodium reduced after dialysis showed an increased preference for saltier soups compared to less saltier ones. All of this evidence goes to show that our bodies are programmed to consume salt out of physiological necessity, not desire or conditioning. I've now gone over all of the evidence I have, so it's time to come to a conclusion on how much sodium we should be eating. I think that in terms of a range, the minimum should be 3 grams of sodium per day. At this amount or over, the salt-retaining hormones are minimized. And if we look at people, whether in a salt restriction study or out in the world, they tend to gravitate to at least 3 grams of sodium per day. Now, this would correspond to 8.5 grams of salt as a minimum intake. Of course, this should not be treated as medical advice. Consult your doctor. There are certainly cases of people where they have certain medical conditions, and they would definitely benefit from eating less than 3 grams of sodium per day. As for a maximum sodium daily intake, this is where things get more nuanced. On an international level, people tend to cap out around 5 to 6 grams a day, and we've seen that there are increased cardiovascular and mortality risks after this. However, we also see that these risks are mitigated, at least to some degree, by having a proper potassium intake and having good blood pressure. Certainly there are other dietary and lifestyle factors that would reduce the risks, such as not being obese, eating a diet of whole foods, and so on. In my video on how much salt our recent ancestors ate over the last 5 centuries, I talked about how, depending on the time and location, they were eating 45 grams, 70 grams, even up to 100 grams of salt a day. They obviously were able to perpetuate the human race despite these high intakes. I think it's safe to assume that they were much healthier than we are now on average. I came to the conclusion in my video on salt and blood pressure that because hypertensives have their blood pressure increased more than normotensives on average, there's probably something wrong with the bodies of hypertensives that reduces their capacity to handle salt. So, this is all to say that if we are truly healthy, eating a proper human diet, and following a healthy lifestyle, we can probably safely eat way more than 6 grams of sodium per day. But as a general guideline, 3 to 6 grams of sodium or 8.5 to 15 grams of salt a day seems to be optimal for human health, although the healthy among us could probably eat way more. And if we're doing things, however, like sweating, taking sodium-depleting drugs, consuming caffeine, or doing anything else that depletes sodium, we should probably eat above this range to maintain a proper balance of sodium in our body. There are 2 options to regulating our salt intake. Either we experiment or we trust our bodies. If we want to experiment, we would try eating 15 grams, 12 grams, 8.5 grams, 5 grams, or any other amount for a number of days and see how we feel. Some may find they feel the best on 8.5 grams per day, while others may feel they do the best on 20 grams. Each person would need to determine this for themselves. The other option is to salt to taste. You do this by putting on as much salt as you find tasty on the food you eat. You'll find that if you put too little on, your food will taste bland. If you put too much on, your food will taste bitter. So you want to look for that sweet spot between the two, with every meal. With this approach, there is no need to weigh how much salt you consume. If you've made it this far in the video, congratulations. I hope you now understand that the World Health Organization's recommendation for us to consume at most 2 grams of sodium per day is completely indefensible. All of the evidence for them to come to this conclusion that I myself have come to, and many others have come to, is just as much available to them as it is to you and me. So there's really no excuse. Organizations like the WHO, as well as our governments, clearly do not care about our health and would prefer to push the agenda of whoever will pay them the most. This is why we need to stop having blind faith in what they say and learn for ourselves what the truth is for our health. If you thought this video was valuable and you would like to support me, like the video, smash that like button, and tell me in the comments about your experience with salt or your thoughts on how much salt we should be eating. The more you help my channel, the more we can help the world become healthier. Make the healthy choice, especially when you don't feel like it.